Nurses and healthcare professionals working with people with dementia may face some specific difficulties. This audiovisual will show you how to manage one of these common difficult situations. Clients who are apathetic, meaning they just don't want to engage with life.
Hi, Mrs. Lewis. I've come to take your tray. Are you hungry? I can come back later when you've finished if you like. Are you okay, Mrs. Lewis? Mrs. Lewis, are you okay? Is there something I can get? You've got some lovely salad and sandwiches here. I can get some chicken soup from the kitchen if you'd rather. Mrs. Lewis, if there's something troubling you, you can tell me. Mrs. Lewis, I'm just going to get the senior nurse. I think you need some help. Hi, Sarah. I wondered if I could talk to you a minute about Mrs. Lewis. I'm quite concerned about her.
Yes, of course, Emma.
I was down in the lounge and she didn't eat her dinner and she seems really upset. I'm not quite sure what's going on. She wouldn't respond to me. Is that something we need to be concerned about?
Absolutely, Emma. Thanks so much for bringing it to my attention. It's always really important, if you think that your client's behaviour is out of the ordinary, to just double check and get some advice. Patients with dementia can go through periods of being apathetic and they'll find it really hard to engage in the world. So let's go down and have a look at Mrs. Lewis together, shall we?
Okay.
Great, let's go.
Apathy can sometimes look like depression. People may lose interest in activities and isolate themselves. People with dementia may experience apathy with or without also experiencing depression. There may be no visible reasons for why the person is not showing interest in their surroundings. When people with dementia display apathetic behaviour, it is important to respond calmly and not to cause the person to stress based on your response. People with dementia may notice you are feeling upset or distressed by their behaviour, and this may cause an emotional response. So stay calm, be aware of anything that is abnormal about the person's behaviour, but do not let them feel concerned that they may be doing anything wrong.
Hi, Mrs. Lewis. It's Sarah and Emma the nurse. Do you mind if we take a seat? Let's take a seat.
How are you feeling today, Mrs. Lewis? You're not feeling very hungry, Emma tells me. You've got some nice looking salad there. I know you love your food because you've always told me how much you love cooking. There's some sandwiches there as well. There's salad sandwiches and a tuna salad sandwich. You don't feel like something just light?
People living with dementia may lack an understanding of actions and consequences. For example, Mrs. Lewis may not understand that if she does not eat, then she will become hungry. Trying to explain this to her would not be helpful.
Emma, would you do me a favour? Could you go to the activities cupboard and grab the radio out for me? I think we need some music. I thought we'd pop on some nice jazz music, Mrs. Lewis. I know you've always loved your jazz music. You used to go dancing on a Friday night when you were younger.
When people with apathy are faced with complex tasks, sometimes it can help to break those tasks down into small, simple steps so that the person knows they are capable to doing each step and will not have to face any risk of failure. If a person living with dementia does not want to engage actively, then it may be an idea to offer them a different passive activity which does not require them to exert themselves. Some people who live with dementia experience apathy and they do not understand why. It is important to make sure that people who are acting apathetically do not feel like they are less valuable just because they do not wish to participate. It is also important to find activities that they are willing to be involved with. This may be things like spending time in the garden, looking at photos, having a pet around to visit. It could also be as simple as listening to music.
About an hour's time and just check on you. In the meantime, enjoy that music unless you want to get up and have a quick dance with me.
It may be important to monitor people with dementia to ensure that they are eating and drinking appropriately. This may include monitoring a person's weight or checking for signs of dehydration.
Looking after people with dementia can be tricky. There are lots of different strategies to help carers deal with difficult situations. People with dementia may show apathetic behaviour, But this does not give us an excuse to be apathetic in our care back towards them. Just remember that these are people who have value. Dementia care is a speciality area of nursing. Why not investigate further to increase your knowledge?